welcome to the fourth general meeting right before spring break. So glad that you guys are attending, and again, hope we can have a great meeting with a great speaker before everyone kind of leaves for break. So we'll just go ahead and get started.
Yeah, so as they're getting at the halfway point in the semester, just wanted to briefly go over the member benefits. There is a document on our member resources page on our website that you can go to find a complete list of all the member benefits that you get for being a paid member and for reaching the different tier statuses that we have within our org. One thing that I did want to highlight is that if you reach the gold or silver status last semester, then you will be able to sign up for our one-on-one interview workshop, where you'll be able to do a mock interview with either one of our seniors in AMSA that have already interviewed at medical schools or one of our great alumni. So that's one of the benefits that we're offering this semester if you were active last semester. So just try to reach those active statuses so you can get these benefits in the future.
And just to reiterate, we do have this easy point stock on our members page as well. Lots of resources there, but this one especially, please utilize this. You can do these points every semester, essentially some of them every semester, and will help you reach that gold status. So a point about the member benefits, those do kind of fluctuate semester and year to year. Obviously, we didn't have banquet in a traditional sense, so obviously those benefits that traditionally are there are not were not provided. But just keep tab on that, and there's always something to look forward to. Specifically, the MSAR is a great resource for gold members, and the interview workshop this semester, again, hosted by our alumni and Armand, who put that together. And again, I want to highlight the applications that are currently out and available. Specifically, the Kaplan scholarships are due March 29th, so a couple weeks from now. I know on the, I think it should be changed on all of the locations you might find on the website and on Discord, but the due date is March 29th, so you have plenty of time to write those. Really low stakes, encourage everyone to apply since it's essentially free money, and you will probably be studying for the MCAT anyway, so might as well get extra resources out of it. And also the officer board application is also open and will be due April 7th. So that deadline is not on these slides, but if you click on the application link, you'll find that very easily. So please ask questions, ask anyone, President VP included, even though you can't apply for those President VP positions, but still ask questions because these officers are doing a great job and are really eager to talk about what they've been able to do and hopefully inspire you guys as well. So if you're interested in getting that peek behind the curtains of what happens and what it takes to run an organization like AMSA, definitely apply. Yes, my animations, okay. And then lastly, something that is a little bit different is we're going to be taking officer board photos for the new officers at the end of this year as opposed to the beginning of the following year. So if you are a photographer or if you know anyone who wants to make a little extra money this semester, please share this link that's available on the slide so you can access this later, these slides later. Please share that form so that they can fill it out and hopefully be the ones to get selected to take photos. So if they've already filled it out, just you can message me directly. They don't have to fill it out again, but it's a great opportunity just to make some money, hang out with the officers for a couple hours, and get your work featured on the website.
Okay, so just some FAMSA updates. Keep meeting up and keep in touch with your groups. If you're a mentor and you're here right now, and you haven't reached out to your groups, please do that ASAP just to get that conversation started. If you have any questions about that, let me know. So your points stuff, like I've been like inputting them and stuff, I update those on Mondays. I haven't done so this week, so don't panic if you don't see that reflected right now, but I will get to that very soon. April will be double points month, so that's a really great time to kind of push ahead of the competition and get farther in the competition then. And then, as you can see, you can meet up between February 27th and May 2nd. May 2nd is the end date. So our next FAMSA event is going to be after spring break. So definitely do sign up for that if you're interested. The link at the bottom left, oh my God, directions. The link on the bottom right is like just for like the FAMSA documents, like anything that you could potentially want to know about FAMSA is on there. And then on the bottom left, that's not a link, sorry, but it's just join the Discord channel if you're not on there already. But yeah, let me know if you have any questions.
Okay, so hi, again, check out the website. There's a lot of fun stuff there, such as the gallery. I really wanted to highlight this week that the member profile page, which is one way that you can see your points, is updated and everybody's profile should be good to go. If you have any issues, just let me know. And then also, if you don't have a member profile set up, you should really make one. It's a nice thing to check your points to see where you stand with regards to dues and the member status. So you can kind of see an example. That's my profile up at the top right. And so you can see like meeting points, med resources and stuff like that. Yeah. Okay, and so now that it's March, we can talk about and announce our member of the month for the end of January and all of February. So drum roll, please. Anchita. Okay, so Anchita Anchita is a second-year biology major. Her interests include archaeology, hiking, and video games. If y'all don't already know her, you definitely should. She is a ton of fun at AMSA events and is always like a joy just to be around, honestly. She's also my mentee. So congrats to Anchita, and I will release your Discord sticker soon. It's a really good one, so y'all should use it.
All right, we've been over this several times already, so we'll go through quickly. We have our safety document posted on each one of our social events. And yeah, please do check it out if you're at all concerned about or just curious about what our safety policies are. And then again, just a little reminder that PCT testing is still going on. You're going home for those of you who are going home this next coming week for spring break, do be sure to get tested before you see your family. And then there are no more socials for the rest of this week, but be on the lookout for 3 socials coming to you between the end of spring break and the next GM. We have Scriblio, Debate Night, and the AMS Amazing Race, which is put on by Krishna and Caitlin.
All right. Big news, buddies. We got IM Sand Volleyball coming up very soon. Like it says, are you looking for a fun time? Because we always have a great time. Do you suck at volleyball but still want to play volleyball? I want to emphasize this point greatly because even if you have never played volleyball, please come out and play with us. Most of us aren't very good and we're just looking for a good time. So yeah, if you're also good at volleyball, please come out and play with us as well. We could definitely use some pointers. But I'm going to release the sign-up sheet tonight after the GM at 8 p.m. And just to give you some more information, games will start April 11th and all the teams will be playing Sunday night at 7 p.m. But yeah, so look out for the sign-up sheet at 8 p.m. and I hope you guys join us.
Hi everyone, it's just some MR updates for you. Like SOCO, we don't really have any other events before spring break except for one last Health Advocacy Week event tomorrow, and that's going to be a collab event with Whole Human Advocacy, another org here on campus, so definitely come check that out, and I appreciate all of y'all's participation in Health Advocacy Week already. But yeah, we'll have international pre-med programs and our first MCAT workshop the week after spring break, or in, I guess, weeks following. But just, yeah, all the other programs and resources as usual are available on the members resources page on the website. And we wanted to specifically shout out the Medical Media Challenge just because we haven't talked too much about it yet this semester, but essentially what that is some sort of like book or podcast that we do each semester. This semester it's a podcast, and throughout the semester there's different like checkpoints for you as to like how far you could be into the podcast by like our discussion date at the end of the semester. So yeah, check that out. We're listening to Dr. Death, which is like the same podcast as we did last semester with season 2. But yeah, all the info is on the website.
Okay, so volunteering time. So for our upcoming events that are in person, we have a couple more like just volunteering events in total before spring break starts. But we'll be making sure to start after spring break on a good note, and we'll have a lot for you. But before then, we have Hope Toast back decorating with Joyce on the 12th. I think that's Friday. And then starting after spring break, we'll be having Meals on Wheels again. And then we'll be starting our UT farm stand gardening since the weather is getting warmer.
Yep. So virtual volunteering is sort of similar. We only have a few more events before spring break comes around. So we have Adopt a Nursing Home on Thursday, so tomorrow, and Helping Hand Home, which got canceled earlier. So this is a really nice opportunity for us to spend more time with underprivileged kids and sort of play games with them, have a good time. So that's going to be really fun. And there will be another event after spring break for that. And after spring break, we will have the first virtual volunteering event will be Tell Children's recording session.
All right, so Layla couldn't be here today, but that's okay because all of her stuff is still happening, as you can see on the calendar. Just want to especially shout out all of the great work she's doing on social media. Hopefully you guys were able to participate in yesterday's AMSA advocacy post and have seen our little promo video. So definitely keep attending those makeup meetings if you need to, and stay involved with us on social media.
All right, fundraising. So our next bucketing event is going to be in April from 10 to 11:30 a.m. And this is where we just go outside to Whole Foods Market and then just hold posters, hold out red buckets so that we could get a fundraise for PCC. And we had our very first one this past weekend where we raised over $60. So thank you guys for all your help. And then we have also our committee meeting after that. And if you guys want to just come hang out, just give me some recommendations or any feedback, you guys are always welcome to come to those meetings. And then finally, we have our social media challenge in mid-April. This is where you guys are able to hold your own fundraiser. We'll be fundraising for American Lung Association. There will be more guidelines to help guide you guys through this kind of social media challenge. So just keep updated with that as we provide you guys with more updates and guidelines for that. And just quickly wanted to give you guys a shout out for this past Scribbler tournament last weekend. We raised over $200 for Salvation Army. So thank you guys so much for your generosity.
All right, and with that, that kind of wraps up our AMSA updates. So again, today is the last day to join UT AMSA. If you need any help with that, please message us, any of the officers really, but also secretaries, Armand is going to be the one handling that. So please do that so that you can continue attending our events for the rest of the semester. Additionally, we have our applications, leadership and Kaplan MCAT prep applications open right now. So definitely take spring break to write those essays and submit them early so you don't forget. Still not many submissions for most of them. So you have a great chance for those Kaplan scholarships, and look forward to more updates about the Officer Board apps later. We have our 5th general meeting coming up after spring break. And if you are going home, or whether you're going home or traveling somewhere safely, please make sure that you're following all kind of recommended guidelines, making good decisions, and all of that while having fun or relaxing. So again, thanks so much for coming out today. And without further ado, we will transition to our guest speaker.
Yeah, so I'm super excited, as always, to introduce all of you to our guest speaker this week, especially in coordinates with our Health Advocacy Week. But everyone, please give a big warm welcome to our guest speaker, Dr. Mullen. And yeah, I'll go ahead and hand it to you, Dr. Mullen, whenever you're ready.
Hi, okay. Hi, everyone. Thanks for inviting me to your meeting. Thanks for showing up. Thanks for all the messages around good public health practice. I affirm you on that. I thought I would talk a little bit, but not make you just listen to me, and then leave time, if it's okay for you guys to ask questions. But I didn't ask Carissa, is that all right?
Yes, that's perfect. We love
That's
that.
good. All right, so I'm gonna give you sort of boring details about my background without making you have to listen to my whole bio. Tell you a little bit about how I wove my way to the path that I'm, been on for a long time, and how I landed at Delmed, and try to, along the way, make you extra excited about advocacy tomorrow and for your entire careers. I've been at UT for almost 2.5 years, and came here a long time after I was pre-med. So I was an undergrad at Yale, psychology major pre-med, who had decided that she wanted to be a doctor way back, probably in around 7th or 8th grade, because I was a science math person and just thought biology and the human body were interesting. But I also grew up in a suburb of New York City that was very diverse, racially, religiously, ethnically, economically, and was able to, from a very early age, see the ways in which access to good healthcare and well-being played out across lots of different demographic groups and ages. And that also, I think that perspective early in life got me thinking about sort of society and the roles that we can play in society, and the ways in which people's privilege sometimes works in their favor, not always works in their favor, and the ways in which lack of privilege are really apparent across many demographic groups, not just race, but especially across racial and ethnic groups. And so as I decided to be a doctor, my thought was just, I want to help people. But I didn't have anything specific beyond that, other than I thought I would practice medicine and be able to give good health care to everybody that I took care of. But along the way, growing up with some awareness of the environment around me, it also struck me to recognize, in a big high school where there were episodes of suicide amongst students, teen pregnancy, substance misuse, injuries and death that were preventable or could have been if there had been good local ordinances that were protective. And so along the way, even though I didn't realize it, I was also developing a public health mindset with the recognition that people's well-being wasn't just related to their medical care, but was also related to the environment that they lived in. I went to medical school straight after college, went to Mount Sinai, now the Icahn School of Medicine in New York, and decided I wanted to do internal medicine because I liked the ways in which the pathophysiology of all the organ systems related. And internal medicine was considered to be sort of the most challenging field at that time, because most people weren't just specializing in heart or liver or kidney, or you choose an organ system or cell that people might decide to work on now, or gene for that matter. And I joined the National Health Service Corps when I was in medical school, one, to defray the costs of my education, even though I can tell you, and this is, you can decide how old I must be, that I graduated from college and medical school with, I think, less than $35,000 in debt total, because tuition was so much less then. Like my Yale tuition and room and board for a whole year were only $5,000 when I started. And so, the cost of education, yeah, sounds like a dream, and it's a nightmare what people have to pay for now. But I just want to put that in perspective when you think about even being at UT and going from here. Education is just way too expensive for everyone to feel that they can access everything that they want to do in their lives. And so I joined the National Health Service Corps in part because I still didn't have a lot of money, and it was even then still helpful for me to have a couple of years of medical school paid for. And I thought that I would go to the to maybe work in an Indian reservation, on an Indian reservation for a while, which I ended up not doing after my residency because I got married and my husband and I decided we wanted to stay closer to Philadelphia where he was working. And after practice for a while, I realized that even though people thought I was a good doctor and I had good bedside manner and could talk with my patients well, a lot of the things that I was doing for and with them and advising them to do for their health, they just weren't doing. And it occurred to me, well, maybe it's just not me, but maybe there's something I hadn't learned about how to really care for people in their community context, which is when I decided to go to public health school and study psychosocial epidemiology as a discipline, in which I did a postdoctoral fellowship to really look at data to try to understand the social and behavioral influences on health. And that was before people were saying words like social determinants of health, but that additional training with the rigor of epidemiology for somebody who always liked math anyway, has been something that has really been foundational to all the work that I've done across my career since then. Because after practicing for a while and deciding, and all of you hear this, and deciding that if I really wanted to change things, I wanted to be in charge of them, I took a job as the medical director of a neighborhood health center where I knew that people deserved good care, but there were some people who were saying things to me like, well, with all your Ivy League credentials, why would you go work at a place like that when you could be working at another Ivy League place? Which automatically, can get you thinking about how people sort individuals and populations into maybe what they deserve or what they should be entitled to for their health. But as the medical director, I could set the tone and expectations for how we cared for people and how we really worked towards delivering high quality care for all. And it was in that work as a medical director where I was also responsible for quality, productivity, millions of dollars of budget, and got to see how state government impacted the way health systems work, that I said to myself, a lot of these people who make policy at the state level never practiced medicine. They don't really know the patient's real life experience, and they don't necessarily know how hard it is for a lot of doctors to practice. So I decided I should go into government. You don't have to do what I did and keep thinking you should do something else, but I'm telling you this for a reason. When I decided I wanted to work in government policy, then I said, oh, but I don't know anything about government, I'm a doctor. So rather than just doing what many people might do, which is to show up and say, I'm looking for a job, here's what I bring, I decided to go back to school again. So this is how I ended up with too many letters behind my name to have my bachelor's, my MD, my master's of public health degree, and a master's degree in public administration, because I ended up applying to being accepted and enrolling in Harvard's Kennedy School in Government for a year to learn public administration and public policy with some real formal training in things like negotiation and public administration, budgeting and accounting for nonprofits, behavioral economics, strategic management, communications, and some other things, some of which I knew already, some of which I didn't. And I'll tell you, before you think you have to also invest in too many degrees, when I got there, the people in the career office looked at me and said, why are you here? Like, what did you come here for? You didn't need to do this. You already have enough credentials to do everything you say you want to do in life. But I didn't start out thinking I was going to end up in government from an early age. I just wanted to be a doctor. So it's not as if I had set myself up strategically over time with some plan that if you could ask me at any particular time, what are you going to be doing 5 years from now? I had the answer, and I had a stepwise plan laid out for myself about how I was one day going to be the Principal Deputy Assistant Secretary for Health or Acting Assistant Secretary for Health at HHS. So it was worth it for me to do what I did. And by that time I had worked as a doctor long enough that I could afford to, but don't take notes and say to yourself, if there's anything I've done in my career that you think you want to do, that you have to do it my way, because you just need to be able to do things your way and follow your passion. But the transition to government was a fantastic one for me because I really, one, had worked so much as a clinician and an administrator that when I talked policy, I could do it from a perspective of somebody who had on the ground experience as a clinician, as an administrator, as somebody who knew how to build community partnerships, and as somebody who knew how the health system worked well and didn't work well, and as somebody who could walk in and say to the people in government, I know you think what you're doing is effective, but let me tell you how it doesn't really work on the ground. And so part of being successful, I think, was that I learned how to say all of that tactfully, because if you tell people who are really proud of the things they do, even if they're out of touch with how they're not necessarily impactful, it's good to know how to deliver the news to them and have them want to be your partner in transformation. So I worked at the Massachusetts Department of Public Health for a couple of years, running chronic disease and injury prevention there, and got to know a lot of people at the CDC who became colleagues, who are still my colleagues even 14, 13 years later. And after 2 years doing that job, was contacted by the new governor in Connecticut, where I had been based for many years, asked if I would be the commissioner of public health there. I didn't know him. I didn't work on his campaign. I didn't know anybody in his inner circle. I didn't donate any money to his campaign, and I was working in a different state. They reached out to me because somebody told them about me. And I'm not telling you that because I'm so special. I'm telling you that because it's pretty much the way I have done things in my career, is just show up and work, be passionate, be deliberate, be determined, learn along the way so that I actually at least know a little bit about what I'm talking about. Stay humble enough, and it's worked for me. So when people over time have asked me questions like, how did you get this job or that job? What I would usually tell them is by just showing up at work. And after now what I've told you, years and decades of my career, I can tell you that that humility and that authenticity and that sort of never-ending desire to learn more, with one's willingness to also stand her ground in the right way, especially when you're standing up for other people, standing up for justice, standing up for science, standing up for what makes sense, has carried me a long way. And so I think that's how it was that after about 5 years of being the commissioner of the Connecticut Department of Public Health, where we dealt with lots of issues, and some of you in AMSA may have heard me in some other venue talk about my time as commissioner, where we dealt with a number of natural disasters, including Hurricane Sandy, think Harvey here, the Newtown, the Sandy Hook shootings, the Ebola epidemic, just to name a few. I had also developed a reputation as somebody who could stay clear-headed during a disaster and collaborate with other people. And maybe that's another attribute I should add, because even when I was a resident at UPenn, during my internship and residency, if they had to call a code because somebody had a cardiac arrest, they used to call me Cool Jewel, because I would show up just trying to say, okay, what do we need to do, as opposed to somebody running around in circles or acting like she had to elbow everybody else out of the way to be in charge. So about 5 years into my commissionerhood, the people at the US Department of Health and Human Services reached out and asked me to come be the principal deputy assistant secretary for health. So that office, Cool Jewel, Dr. J. I've also probably have some profane nicknames too that people only say behind my back, but my parents nicknamed me Tiger, so I'm a pretty deliberate person. The principal deputy, the office of the Assistant Secretary for Health, is the office in Health and Human Services. That's the public health advising office for the Secretary of the Department of Health and Human Services. Right now, with the Biden administration, we're waiting to hear whether or not the Senate is going to confirm Mr. Becerra, the Attorney General from California, who is Biden's nominee. Sylvia Burwell was the HHS secretary while I was there. And so in that office, we do in public health advising work that relates to chronic disease prevention, work related to LGBTQ health, women's health. The Surgeon General's office reports up to the Assistant Secretary for Health, which means the Public Health Commission Corps, all those uniformed officers, public health service officers report up to that office. The 10 regions, public health regions of the US and the territories, their leaders all report up to that office. There's another office that really focuses on human research protection, and another one on research integrity. Another office that is the National Vaccine Program Office, which you can imagine has been pretty busy right now. And that advisory office for HHS collaborates a lot with folks at CDC and a number of other health agencies. While I was there, we also did a lot of work on climate change. And one of the reasons they said that they asked me to come was because my position was a career one, which meant that when all of the political appointees had to leave with Obama, I would be one of the people who could stay through and work on the transition. So I was able to work both with the outgoing administration for their last year, but then be one of the transition people. So over the past months, we heard about the Trump-Biden transition. So I was one of those folks who worked with the new people coming in and getting them up to speed, and stayed for 6 months into it, but also was ready to go, when I decided to leave, let the new people come in and advance their policies, which were probably going to be some that they weren't going to trust that I would advance, but and I wasn't going to be somebody who was there to fight the system. And I had colleagues who would say things to me like, "Oh, we're so glad you're there to fight the good fight." And I wasn't there to fight any fights. I was there to actually do public health. So serious story. For all the things you read in the paper about the intrigue of dirty politics here and there, they do exist. But I can tell you, I have none of those stories. And so far, still nobody's had to pull any knives out of my back, nor have they had to pull any knives out of anybody else's back that I stuck there, because I don't play that way. Which is it's a good thing to be able to say in this really hyper-political, hyper-partisan world that we try to do so much in. I know I'm talking a lot and I'm gonna stop soon. So I came to Delmed with all that experience, with the medical school, as you know, really declaring that it has a mission that, thank you, Aditi, but that it has a mission that really wants to revolutionize how people get and stay healthy. And it's a really worthy mission, and very much easier to say than to accomplish. And I came there, as you hear, as somebody who's from New York, who's worked in New England, who's lived in Connecticut, who has proven that she can work with Democrats and Republicans, and who still feels that you have to be able to work with everyone if you want to get everything done. And you don't have to sacrifice what you believe personally, but it's really important to figure out how to keep a lot of people at the table to work on behalf of society. And some people hear that as compromise. I describe it as knowing how to work with people strategically, but also knowing what your non-negotiables are. Because You can always decide to try to get work done in a different way if you feel like where you are, it's not working for you. So some of my colleagues say, how could you work in Texas? Texas? You're in Texas? And I say, yep. Then they ask me to tell like Texas stories. And I say, Texas is the microcosm of the US. But I also say, if you don't have a lot of resources, there's a lot of harshness here, because many of the things that people need for their well-being are not easily accessible to them. And in fact, sometimes it seems like there are like roadblocks put in the way of their being able to access them. And that's not even just a personal opinion. If you believe that everybody have access to healthcare, and then you consider that we're in the state that has the highest percentage of uninsured adults and kids, and that within that, it's still hard for people to access health insurance because we aren't really wanting to expand Medicaid or really participate in the opportunities afforded by the Affordable Care Act. Some might hear that as a political statement. That to me is a policy statement and a reality. And what continues to make it a policy statement, even if somebody wants to help see it as only political, is that to me, from a policy perspective, if you're going to say no to something that is really a good possibility for people's well-being, then it's really constructive to say what the alternative will be. And if the alternative mostly translates into they don't have access to well-being, that, in my view, is not just. So I have been told that I have a way with words. I have been challenged, as people have said to me, why don't you speak more stridently and more politically? And I say it's because I'm a public health person and a doctor. I'm not a politician, but there are politics in everything. And some people have called me an advocate or an activist because I am willing to speak on behalf of others. But I like to lead with heart, with science, and with a commitment to justice. And I think one can be intellectually honest looking at data and the circumstance around that and do them. And do that from any perspective and any political spectrum, if they do it with intellectual honesty and a willingness to think from the policy all the way down to the impact on the people who have to live with the impacts of the policies. I think this is a really interesting time for you all to be thinking about going into medicine, when now across the US, medical schools are really challenging themselves again to consider why they're not sufficiently diverse and to consider how they are going to transform their curriculum to make sure learners come in and understand the impact of discrimination by race, gender, geography, ability, but especially the impacts of racism, but not just the impacts of racism on people's ability to be well, and to incorporate that into medical school curricula, that people should consider that their learners insufficiently educated if they haven't gotten enough of that information to really have some competencies. And why do I say that? Because no matter what you do in medicine, and there are many different things that people can do in medicine, I would hope that whether or not you're in technology, whether you're in health insurance, whether or not you're practicing, whether or not you're doing research, you never forget that the health system is really set up to pay attention to people's ability to be healthy. not just to attend to medical need, but to really be healthy, that's what a health system does. And to really be able to think about that on a societal level, it's really important to understand the history and social science that impacts how those systems work. So think about that, because we're still at a time where Delmed faculty, colleagues, medical students are saying, wow, I never learned that before. I never understood that before. And we can always say it's a failure of the education system, but all of us, all of us are really good independent learners too. So I encourage you to stay open to what's going on around you. And I'm going to use an Eyes of Texas example, which has nothing to do with the decision that the president announced, but just perspective. I was in a conversation with some folks last week, just saying, oh, the song of the century, I wonder what's going to happen, or the song of the century, as I called it. And some people and to me, being on UT's campus, even if you didn't hear about it on campus, you might have heard about the controversy on CBS News and the paper somewhere. And some people were saying, yes, this is just another bad example of how hard it is here. And other people were saying things like, oh, I have 3 kids and I've been busy, or I read the paper, but I missed the story. And does everybody need to know everything? Nope. Do I know everything that's going on locally? Nope. But even if I don't look at everything that's going on in Austin, what's been going on around that song has been, a big issue for the university, along with some other social issues. Once again, I'm not telling you how to feel about it, but it certainly is helpful to know what's going on with you locally. Even if at the end of the day, you have this view that you want to be some internationally known researcher, clinician, writer, or something. The stuff that's going on around you locally is something that you can always influence through advocacy, through knowledge, and through caring for yourselves and through partnerships. So I didn't, ridicule my colleagues who said they didn't know anything about it. And I also didn't look at them and say, are you serious? Even though part of me was thinking that. But as future docs, one of the things to remember is medicine is a profession of service, no matter what you choose to do once you enter it. And to be of service to others, it's really important to understand what's happening in their lives and what's impacted their ability to be well. And that's why I just use that as an example, because it takes paying attention to what's going on around you to be able to impact what's going on around you. And I think through my career, one of the reasons that I've been as successful as I have is that there's always been a kernel of impact around me that influenced the ways in which I could have much bigger impact as well. So I don't even know how long I talked, because I'm just looking at you guys' names and pictures, but I think I'm going to stop there.
Thank you, Dr. Mullen.
You're welcome. Thank you for having me. Thanks for listening. Take care of yourselves.
Thank you.
Thank you so
You're
much.
welcome.
Again.
Thank you so much.
All right, thank you.
Thank you.
You're welcome. Bye-bye.
Good choice.
Oh my
This
goodness.
is better.